Many people have asked me why we should support this Senate health bill, and I can tell them unequivocally that we should. Why? There are several reasons. The first is I've met hundreds of people all over North Carolina in the last year who are desperate for decent health coverage. They want to pay for it, but they simply can't afford it. This bill will allow them to do that. In addition, I've talked to many people in small businesses who need health coverage. And this bill, for the first time, provides substantial subsidies not only for individuals, but also for small businesses so that they'll be able to afford health coverage. Next, the Senate bill does what we've wanted for years. Provides an absolute floor so that any family or individual, no matter how destitute, no matter how much they've lost, will always be able to get the health coverage that they need. Third, the Senate bill does something that we've wanted for years as well. It reins in insurance companies like Blue Cross Blue Shield. No longer will Blue Cross be able to charge, as we've heard over this summer, $2,000 for a young woman because she had a diagnosis of breast cancer 10 years before. $2,000 a month premiums, that's just ridiculous. That's not going to happen anymore. In addition, there are strict rules about how much insurance companies like Blue Cross can spend on administration and profits and how much they need to spend on actually providing health care to patients. Finally, this bill starts to take the first steps we need to do to rein in out-of-control health costs in this country. Health costs have doubled in the last 10 years. We cannot afford to keep allowing health costs to rise at that same rate. It is simply not sustainable. It's not sustainable in Medicare, where we're taking immediate steps under this bill to rein in health costs and promote efficiency, and it's not sustainable in the private market. I can't tell you how many small business people I talked to who said their health premiums have gone up 30% in the last 2 years. We can't afford another 2 years of 30% increase in premiums, and this bill starts us on the road to containing those costs. Finally, to those of you who are saying, well, this is just a giveaway to the insurance companies, North Carolina Blue Cross is not happy with this bill. In fact, North Carolina Blue Cross CEO Bob Gretchen took a trip over to the News and Observer editorial board last week where he used blatant misinformation to promote the idea that this bill should be killed. Why is he so frightened about it? Because of the strict rules that it imposes on companies like his to ensure that companies are run for providing health care to people and not for making simple profits. Now, this bill isn't perfect. It doesn't include a public option, which would be enormously helpful to people in North Carolina who are sick of having only one insurer, Blue Cross, to choose. And it doesn't include other things that we'd like to see, like more strict cost containment rules on health care. But these are things that we can fix. For right now, this is a bill that is worth passing. It contains health costs, it will ensure security for everyone in North Carolina, and it will mean nearly 1 million people in our state will be able to get health coverage.